On vaccines will hold an emergency meeting to discuss distribution. There's an argument, of course, that frontline healthcare workers and those in nursing homes should get their doses first. But after that, there's some decisions to be made. On December 10th, an FDA Vaccine Advisory Committee will consider Pfizer's vaccine for emergency use authorization. Now, it could take hours or weeks to approve it. Moderna's FDA meeting will likely be held a week later. And as we learn more about COVID vaccine, our local hospitals are also starting to prepare. There are a variety of issues that will need to be sorted out. Our Olivia Sandusky joins us now from Eisenhower Health with more on when those vaccines may get to us here in the Coachella Valley. Olivia.
Gino, today Governor Newsom said California is expected to receive about 300,000 doses of the Pfizer vaccine within the next few weeks. Now, here at Eisenhower Health, they aren't sure when those will arrive or what portion of that number that they'll receive, but they tell me they're ready. As the coronavirus death toll continues to climb, medical experts celebrate the progress of two vaccine candidates.
Having both of these vaccines is light at the end of the tunnel.
By the middle or end of December, we would hopefully have an emergency use authorization and be able to begin deploying the vaccine.
In the meantime, local hospitals are sorting through logistical questions. One main factor, Pfizer's vaccine must be stored around 94 degrees below zero. But Eisenhower Health staff says they're prepared.
We do have freezers here already on site that are capable of storing the vaccine at the temperatures that are required, but they do have somewhat of a limited capacity in terms of their size. So we're also looking at how many doses are we really looking at right now? That's still a question mark, hasn't been answered yet by the state.
Time is also a key component because once the vaccine thaws, it has to be distributed within 5 hours.
And that's a challenge because we have to be sure we have maximum utilization of the doses that we're going to get. This is obviously going to be a relatively precious commodity early on.
Another concern, the coronavirus vaccine requires 2 doses, and Eisenhower Health is working through a follow-up process to make sure patients return.
Otherwise, there's a significant decrease in effectiveness if they don't receive the 2 doses.
But one question still remains. Will Americans feel comfortable getting the vaccine? In a November survey, Gallup found 58% would agree to be vaccinated. But Dr. Williamson says he expects that number to grow.
Even if worst case scenario, we were getting 60% of the population vaccinated, that would still produce a significant decrease in the spread of the disease among the community.
Dr. Williamson also tells me once those priority groups are vaccinated, the general public, it'll be available for them around early to mid-spring. Reporting live in Rancho Mirage, Olivia Sandusky, NBC Palm Springs.
All right, thank you, Olivia. And there is a third vaccine candidate, this one from Novavax. It'll begin stage 3 trials in the U.S. very soon. They were supposed to begin in October, but were delayed because of manufacturing issues. There are already trials underway in the UK and in South Africa.
CVS and Walgreens are preparing to be among the first companies in the U.S. to give coronavirus vaccines. The government reached an agreement with both pharmacies in October to give vaccinations to long-term care residents nationwide. Now, this would not take place in stores, though. A CVS spokesperson says they expect to be giving shots in mid-December. Walgreens expects to start doing so within